You might think that conversion practices are a thing of the past, but the reality is, they still exist, even today. Yes, that's right. So, let's look at what conversion therapy is, its history, and why it's so crucial to keep this conversation going. Conversion therapy, also known as reparative therapy, is a set of practices aimed at changing an individual's sexual orientation or gender identity. The idea was to cure someone of being LGBTQ+, based on the belief that being anything other than straight was wrong or abnormal. Sounds horrifying, right? But this was actually considered legal in many places for a long time. To give you some historical context, let's start back in the late 19th and early 20th centuries, where homosexuality was often labeled as a mental disorder. Sigmund Freud, for example, was one of the early figures who, although he didn't actively promote conversion therapy, laid the groundwork for others to do so. In the 1950s and 60s, things took a darker turn. Electroshock therapy and aversion therapy were used on LGBTQ+ individuals in the hope of curing them. These practices were not only harmful but also incredibly traumatic. Sadly, many people suffered under these medical treatments. Fast forward to today, and conversion therapy is still legal in many parts of the world. Despite being criticized by major health organizations, these practices exist. And it's not just in far-off places. Even in the United States, there are still states where conversion therapy is legal, especially for minors. It's important to remember that conversion therapy isn't just ineffective, it's deeply damaging. Studies have shown that individuals who undergo these practices are at a much higher risk of depression, anxiety, and even suicide. This is why it's so crucial to speak out against it and support those who have been affected. But there's hope. Many countries and states are banning these practices, and more people are becoming aware of the dangers of conversion therapy. If you or someone you know has been impacted by this, know that there are resources out there to help, and you are not alone. If you're looking for support, consider booking a trial therapy session with us. We're here to help you.